One of the most complex structures in our body is a good old shoulder. It's worth knowing a little bit about the biomechanics of the shoulder. Keeping it simple to kind of help us, and it might help us with some of our treatments. The shoulder complex itself is basically made up of 4 joints. We have the sternoclavicular joint from the sternum to the clavicle, the acromioclavicular joint from the clavicle to the acromion, which is part of the scapula, the scapular thoracic joint, and the glenohumeral joint. The only place in our body, or in our shoulder complex, that has an attachment to the axial sort of skeleton is the sternoclavicular joint. And it's a very important little joint, because if that cannot move, then, or doesn't move properly or optimally, then these other joints will not move optimally either. So often it's overlooked, and sometimes just getting somebody to do a normal movement and with a little bit of pressure on this joint can increase their range of movement considerably. Bear in mind, basically the shoulder's going to flex, abduct, extend, externally rotate, internally rotate, and all of that takes place at the glenohumeral joint, which is basically ligaments and muscles. But for that to occur, the scapulothoracic joint here has to basically rotate around the rib cage. And for that to occur, there has to be movement at the acromioclavicular joint. And if that is not allowed to move at the sternoclavicular joint, we start having problems. So basically, often it's just even a couple little mobilizations in the region of the sternoclavicular joint can be very, very useful. And then that will allow us to maybe mobilize the acromioclavicular joint, and then the scapulothoracic joint can then move, and that will then allow the humerus to move in the directions we want. Bear in mind, as this scapulothoracic joint moves around the chest wall, it's basically lifting up here and allowing this bumpy, lumpy thing here called the humerus to glide underneath the acromioclavicular joint. So it's very, very, or underneath the acromion rather than the acromioclavicular joint. So it's very, very important that we allow these things to move. And one of the things that can and often sort of causes a problem, apart from stiffness at certain joints, is problems with the way the muscle tissue is working. It may be trigger points, it may be just tightness in muscle, it may be a restriction in the muscle for other reasons, it may be that the muscles are imbalanced in the way they're working, or there are some sort of postural problems. So for example, we don't want the rhomboids working too much, because what's going to happen if they're working too much, they're going to tilt this scapula down, this is going to get trapped, so it's not going to lift. We need the serratus anterior to be working nicely around here, like in this punching movement, because what does it do? As it moves and contracts the serratus anterior, the scapula glides around the chest wall and moves up, allowing the humerus to move underneath the acromion. The trapezius. Now the trapezius is often really badly affected, along with levator scapulae, with trigger points, especially the upper fibres of it. We want the mid to upper fibres of the trapezius as they come down and insert here to be able to actually work and pull this scapula up. We don't want levator scapulae with tight trigger points or tight muscle tissue coming in here and pulling it down. So one needs to consider the biomechanics of the shoulder when we're trying to improve sort of shoulder pain and problems, and therefore by looking at the various muscles that are involved, again, rhomboids, we don't want them tight and short or too inundated with trigger points or lack of mobility. We do want the trapezius to be able to move, so again, the muscle tissue to be able to work optimally. Similar with the levator scapulae, we don't want it to work too much or be too tight, because it's not going to allow movement. We do want serratus anterior to move nicely, and that's before we even get on to anything to do with movement of the humerus and the upper limb. So they're basic things to remember. Address the muscles that could be tight and restricted. Address the muscles that be underactive and sort of giving way, and mobilize the sternoclavicular joint, and hopefully we can sort of relieve a lot of pains, including problems with frozen shoulder or whatever.